So, close your eyes. Take a few moments to breathe in and breathe out. But I would say on a deeper level, it's more like when we say work on yourself. That involves all kinds of things about moving your life forward. And they struggle with
motivation in these things.
It's because when I don't think I'm worth it, I'm not worth fixing.
When you develop empathy and compassion for other people, there's going to be room for someone else in the relationship. And then this in turn is going to reduce the feeling of being an object. Now two people can connect. And now it's not about getting your needs met and starvation. It's about two human beings forming a relationship.
Hello, chat. How are we doing today? Happy Friday, everybody. Welcome to another Healthy Gamer GG stream. My name is Dr. Alok Kanoja. Just a reminder that although I'm a psychiatrist, nothing we discuss on stream today is intended to be taken as medical advice. Everything is for educational or entertainment purposes only. And yeah, so here is what we've got. So today we have an interview with Dan TDM, who is an amazing YouTuber who's got like almost 30 million subscribers, which is insane. So makes awesome, awesome content. We are lucky enough to be talking to Dan today about whatever he wants to talk about. So for those of y'all that don't know, we go into this stuff relatively blind, which is what we do on purpose. So we don't do a whole lot of research on people. Sometimes I have heard of people. I'm aware of who they are vaguely. But we tend to find that we get the best conversations when we don't bias ourselves based on the opinions of the internet. So I know it's been a little bit since we've streamed and stuff. We kind of took a break. We made a ton of content in May. So we were streaming like 3 times a week, and in addition had uploads that were going up on our YouTube channel. So we did everything from deep dives to interviews to, lectures to Q&A to like more fun stuff. We also had some content on the membership side. So we were sort of producing at a 3x rate. So we took a break for a little while because we definitely needed it. We're going to be traveling a little bit next week. And then I'll be taking a little bit of time off in July. So we don't want to get burnt out and all that good stuff. But we still do have, I think, a lot of lectures that we'll be uploading for y'all to check out. I feel very, very confident in many of them. I think there's a lot of really cool stuff coming down the pipeline, so stay tuned. But just wanted to let y'all know that, it's been a little bit of a break. We recognize that we all need a break after Mental Health Awareness Month. So I think we can actually hop into the interview. So let me just see if Dan is around. Are y'all doing okay, chat? We doing okay? Let's see if Dan is ready. Okay, cool. Dan is here. So we're just going to hop right in. So let me do this. And then I got to do this. Hey, Dan.
Hello.
Hello. Okay, can you just count to 10 for me?
Yes. 1, 2, 3, 4,
Perfect.
5, 6, 7, 8, 9, 10.
Perfect. I think
For my first test.
we're set. Let me just go to this and hopefully this will work. No, Gigi. Give me a second. Okay. And then let's go here. There we go. There you are. Lovely.
Cool. Hello.
Hello. Welcome.
How are you?
I'm doing well, man. How are you?
Yeah, I'm doing good too. Yeah.
Yeah.
Thank you.
So can you start by just telling me what do you go by? What do you prefer to be called?
Just Dan is fine.
Cool. And it's a pleasure to meet you, Dan. So thank you so much for coming.
You too.
I understand you have a gigantic YouTube channel.
Yeah, it's pretty big.
Yeah. What's up with that, man?
Literally, I ask myself the same every day, to be honest with you. Yeah, it's we're closing in on, we're on 29 million soon, I
Wow.
guess. But yeah, it's crazy.
And how long have you been making content on YouTube?
It will be, I think it's 11 years soon, if it's not already passed. But yeah, just over 10 years.
Wow, cool. And how did you get started?
I started making YouTube videos so I'm obsessed with Pokemon cards.
Okay.
And I used to play the game. Like, a lot of people collect, but don't actually know how to play the game. But I used to play the game. And there was a small community for that. It's massive now, but it used to be much smaller. And I started a channel called Pokemon Dan Level 45, where I would go over like strategies and stuff. And that grew to a decent-ish size for the hobby. It was maybe like 10,000 subs, something like that. But it was enough to basically self-fund the hobby. So I got a sponsor from like a card shop, and that's how I got into YouTube. And then for the gaming side, I used to watch when Minecraft started like blowing up on YouTube. I used to watch like the Yogscast, Captain Sparkles, all of those people. I was like, you know what? I already make videos. I started recording some of the Pokemon games for the Pokemon channel. So I'd already kind of figured out the technical side of it, which is way different back in like 10 years ago. So I kind of was like, you know what? I'm just going to try this on the side. Why not? And then the side channel became the main channel. It just absolutely blew up. I think it took like less than a year to go absolutely crazy. So
Wow. And what's your understanding of why it blew up so fast?
actually, I think it was just I'd seen what other people were doing. So there was like the first wave of YouTubers. We're saying like Yogscast, Captain Sparkles, Sky Does Minecraft, that kind of group. And then I was part of maybe like the second wave, I guess, where I'd seen what they were doing and then felt like I could do the same, but then got into like story-led content, like
Hmm.
solo story-led content, which not many other people were doing. So it was taking Minecraft, applying stories to it, and being able to upload that like every day, pretty much.
Okay, so it sounds like consistency was really important. What do you mean by story-led Minecraft?
So mod reviews were a big thing, and they're a bit more. The old ones were more like tutorials. So mods were coming out like every day, like
Hmm.
so many mods were coming out every day. Not like now, and so there was content all over the place, and usually people would download the mod and then go through it, tell the user how to use it. So it was way more tutorial. Whereas I would have these characters which would experience the mod with me, so I'd still tell people how to use the mod, but it was
Right.
more from like a story perspective than a
Interesting.
tutorial perspective. So it was a
Yeah.
bit more fun. And then from that, I took all the stuff I learned from these mod reviews and built like my own mod pack basically to tell stories. Like I'd literally make my
Hmm.
own stories in the game. So you could only really get that content from me basically. So
Right.
that's when stuff really went crazy. Yeah.
That's super cool, man. And so
Yeah.
you still make Minecraft content?
I stopped for a while. There was a push. There was a. I can't remember what year it was, but there was a time on YouTube where Minecraft just fell off a little bit, and I probably didn't play it for like 2 or 3 years. Um, and at that point, I kind of transitioned into just general gaming, and that's another thing that I think propelled the channel even more. So there was like the Minecraft explosion, but then I managed to transition into just general gaming as well, which worked out really well. I ended up just being able to play whatever I wanted, basically, which was awesome.
And what are you
And
playing
then,
nowadays?
so I recently, in the last month or so, started Minecraft again
Okay.
because I took a long break from that. Minecraft 15 years is out, so they're doing loads of content around that. The new update just dropped as well, so it was a good time I felt to like come back into Minecraft. So
Cool.
that's what I've been doing, and I've been taking a lot of time off. So
How's that been?
it's great, actually. Yeah, really, really good. I was meant to take January off. I said to myself, I'll take January off, and that turned into February, and then
Oh, wow.
March, April, May. So I started uploading regularly again, like about a month ago, really. Yeah.
Okay, cool. How does that work taking time off? Because I mean, I hear a lot of people really struggle with taking time off.
Yeah, it's a bit of a challenge because I mean, I when I started YouTube, I was doing 2 videos a day, then went to 1 video a day, and then when I had my first son, which was 4 years ago, I that transition was hard because obviously you have like to prioritize differently. My main
Hmm.
priority for a good like 6 years was YouTube. That was literally it. I'd wake up, make videos, go sleep, rinse and repeat every day.
How many
Um,
hours a day would you work?
like my entire my waking time, I would just
Wow.
work from like maybe 10 a.m. till 5 probably, but every day we're talking.
Yeah.
So like
Saturday, Sundays?
weekends,
Yeah.
yeah, yeah. And then in the middle of that, I was doing conventions. So if I went to a 3-day convention, I would have to double the videos as
Hmm.
well. So I'd make 6 in advance, which means some days I'd be making 3 or 4 in a day, or just do super late nights till like 1, 2 a.m. I edited them all myself. I did all my thumbnails for a long time. Um, yeah, I don't really know how I did that, to be honest, when I keep
Yeah, it's
thinking about it.
crazy. Like that's I
Yeah.
know the feeling. I think that's something that a lot of people I've been really feeling that recently where
Mm,
so well, the weird thing is kind of like you mentioned, like so I'm taking a work trip next week for a couple like 2 days, 3 days, but you know the uploads have to continue.
yeah.
And then I'm going to take some time off in July, but I have to do all the work before that time off, which is
Yeah, you have to
interesting.
double it up.
And
Yeah.
it was interesting because in medicine, you know, it's actually the opposite. Like I think in medicine we've done a really good job of like coverage. So when you like leave the
Nice.
hospital, like a different doctor takes over and then like they're responsible for everything. So you really do get to mentally check out. It didn't used to be like that, but the field I think has gotten better in that way.
Yeah, that's good.
And is there something in particular that you wanted to talk about today, or anything you're kind of curious about, or?
I'm happy for you to lead. I mean, I've been quite open about mental health and stuff that I've dealt with, including like why I take breaks and why I take long breaks, um, which has been very beneficial. So I have lots of material out there on mental health, and
Yeah,
I've tried my best to deal with it. So
I'd love to hear about that.
okay, I guess my biggest mental challenge was the transition from no kids to one, and then having a newborn in a pandemic. That was a massive challenge. That was probably my hardest challenge ever. And combining that with like having to juggle like the content as well at the
Hmm.
same time. So you've got pandemic, newborn, and trying to transition from how am I going to run the channel, like do my day-to-day job with all these extra responsibilities, I guess.
Yeah,
So that was super challenging.
sounds like it. What was challenging about it?
I think the isolation was the most challenging because like when you're a new parent, you know nothing pretty much. You can prepare as much as you want, but it's still super hard. And then not having the ability to have your parents around, have well, anyone around basically. All you can do is Zoom calls is extremely difficult. You can't even have like professional help really. Like if you wanted to hire a nanny or anything like that, that you couldn't do that during that time. That was just
Wow.
not possible.
Yeah,
So
it's nuts, man.
yeah, it was really challenging.
And so, you said you can try to prepare. Did you try to
Yeah.
prepare for parenthood?
Yeah, we did these like me and my wife did these parenting not parenting classes. It was more like focused on pregnancy, birth, and then the few weeks after that. Like over here they're called NCT classes. We did those, which prepares you a little bit, but then the birth can be completely different and then you're thrown all these new like scenarios which are highly stressful, and as the male in the scenario there's not a lot you can do. So that was like a massive shock to the system as well.
So I'm so curious about that. So a couple of things.
Mhm.
One is you said in this part in this part of the world. So I don't want to dox you, so don't give me specifics. But what part of the world are
Okay.
you in?
Oh, I'm from England, the
Okay.
UK.
And you said that like these classes prepare you for some things. Like what is it like? I've never been to one of those classes.
Oh, okay. So they do like the end of like pregnancy, preparing for birth, and then what to expect at the hospital, but then they can't cover there's so many variables when you go to hospital for someone giving birth that just does they don't hit everything. And if they try to, then there's not enough detail, but there's just so much that could go right, so much that could go wrong. And then you're just shoved into this and you just have to experience it and get through it basically. So they do that. Then there's like feeding the first few weeks after having a newborn. But again, every child, every newborn is so different. Like you can't cover everything, and then you're worried you're doing things wrong. Like it's yeah.
Yeah.
They tried to cover all that stuff, but I think it's an impossible task, to be honest.
What was it like for you to, have a child, and then it sounds like you were worried. I think it's very reasonable. I've been worried too that you're doing things
Mm,
wrong. And even med school
yeah.
doesn't prepare you sufficiently. It's crazy, right?
Okay.
For all
It
the
is crazy.
permutations. It's like I've
Yeah,
literally delivered babies and still insufficient preparation because I delivered like three.
that's mad.
And
Okay.
then there's like, people who do this every single day and will deliver like four a day for their whole career, and they're sufficiently prepared. So,
Yeah.
so what was it like for you to go to those classes, and what was kind of the process of, presumably it was your wife was the one who gave birth.
Yeah. Hmm. Um, I think I'm a very like go with the flow kind of person. So I was like, I know all this stuff now. I have a terrible memory, so as soon as I'm in like a stressful situation, my mind's like blank. It's like wiped everything. So everything I learned in that class definitely went out the window that day. But um, I lost my train of thought. I was gonna say, what was the question again?
I was just, what was your experience like of, going through the birth process and the period after? What's it like to
It was
become a
just
dad?
it's great. Like it really is like seeing someone give birth is just the most incredible experience. I know a lot of people say that, and they say that to you before you've experienced it yourself, but it is an insane experience. Like, I can't even put it into words unless you do experience it yourself. That whole process is crazy, like, and then you're just left to look after the human. It's actually nuts. Like, we were in the hospital a few days because he wasn't feeding properly, but still after 4 days they're like, okay, you can go home now, and then you just gotta do it, I guess. So
Wow.
it's
Yeah,
quite
that
a
sounds
responsibility.
that sounds scary, especially if y'all were there for a couple days and something wasn't going perfectly. I can
Yeah,
imagine that when
exactly.
you go home, you're worried, like, what if something else doesn't go perfectly? Like, what do
Yeah.
we do?
Yeah, and now we've had two. You can kind of like with your second, you're like, oh yeah, this is fine, this is
Yeah.
fine, it's okay.
Yeah.
But the first one, I think everyone is like proper on edge about doing everything wrong. 'Cause they seem so delicate and like fragile, which they are. But then you realize that not everything has to go perfectly well.
Yeah.
But first time round, you're worried that it needs to,
That's
basically.
interesting. So you said that the process of watching someone give birth, you said it was like amazing?
Well, okay, so
You some
incredible was the word I used.
incredible. Yeah. So,
Yeah.
tell me what you mean by that, because I was wondering if we've actually had pretty different experiences. What do you mean by incredible?
So okay, so the first time was less incredible because it was in hospital. There was lots of like doctor involvement. It wasn't just like midwife and just let the process happen. There was lots of that was a scary time because like I can't do anything. Like there's
Hmm.
nothing I can do. I just have to sit, watch, hope everything goes fine. Second time round, we had home birth, and that went literally the smoothest possible. So
Wow.
that was an incredible process because as well you don't enter like midwives come to you. You have two midwives, and then the whole process happens, and then you just like left at home, which is actually really nice because you're not in an unfamiliar environment. You just kind of go back to your day to day, more relaxed and chilled out, I guess, about the whole thing. Even though you've now got two kids to look after, you start off just on a much better foot. So I would say, yeah, first birth was less smooth, but second was I don't think we could ask for any better, to be honest. It was so incredible to watch.
Yeah. So that's interesting because you used the word incredible. I remember like my
Mm.
experience of delivering my first baby, and how absolutely like terrifying it was. And I remember going home that day, and I don't know, I guess I was married at that point, and telling my wife like, you should never have kids. That was just like, I
Oh
mean, just
god,
how intense and scary. And there's just,
intense is a good word. Yeah.
yeah. And I was like, I think I had done surgery before I did OB. And so I
Hmm.
was like, I thought I was prepared after doing like surgery for 3 months. Like, okay, like I know what the operating room is like. I know, humans sometimes bleed, but the amount of blood in surgery is like milliliters. And
Okay.
and the amount of blood in delivery is like liters.
Yeah.
And it's just there's just so much more of it. And it was like I was terrified. I
Yeah.
almost passed out one day, which is
Oh really?
interesting. But anyway, all just part of the process of getting used to it. So when you were like, "Oh, it's like amazing," I'm like, I know people describe it that way, but it's very intense and incredibly scary, or it
Yeah.
can be incredibly scary. And it's also
Hmm.
interesting because our second kid was, I guess, in some ways similar to yours. We did hospital deliveries for both of them,
Hmm.
but it was just like so much easier. And then
Yeah.
we were
That's
kind of
what
like,
it is.
yeah,
The
we're gonna,
second time round, you're just so more relaxed in
yeah.
general.
And
Like
I think
even though it can
also
be so different.
like oftentimes, it's interesting. I remember when I was delivering babies in med school, my second delivery, I was somewhat scared because I had such a traumatic experience with the first one. I mean, nothing went
Right.
wrong, but it was just, and so
Mm.
the patient that I had, I think she was having her fifth or sixth child, and she was the
Wow.
one that was like reassuring me.
Yeah.
And she
I
explained to
can
me, she's
imagine.
like, my body knows what to do now. And it was over in like 15 minutes. It was like,
Fair. Yeah.
it was
That's
just like we went
incredible.
in and then like the labor starts. She's like, yeah, the kid's coming. And then it's easier the second time around for if you're
Yeah.
lucky anyway. So that's
Mm.
that's so interesting. And so it sounds like the pandemic was super challenging for y'all. Like in what way?
Yeah. So I can't remember how much different each country's approach was. But the UK shut down for like 3 weeks at least. That was when you just couldn't do anything. You had to stay inside. You could get food, but that's it. But it seemed to just then get extended. I think it got extended to like 6 weeks, and then even further, and then even further. It felt like a good 3 months that you just weren't allowed to leave your house. And as someone that works at home as well, I didn't even have. We were just in our house for 3 or 4 months with a newborn, trying to learn all this stuff. And there's a lot of research about like the village mentality and support network of having children, like what we used to do years, hundreds of years ago. You have a family, and then I guess it's like kind of tribal. That's the best way to describe it. You have all your relatives around, and the whole tribe look after the family. That's kind of relevant today as well, but we didn't have that. Like no support whatsoever, no respite, no nothing. And then I don't even know what particularly. I guess I was more worried about, was I doing everything right? We had a lot of troubles with feeding Asher as well, so there was a lot of stress with that, going in and out of hospital. And then I think my mental health just took a massive decline. Like by probably the second month of the pandemic, I was probably at my lowest I've ever been, to be fair.
How so?
I don't want to be here anymore. I was done. Yeah.
That's super scary,
I was
man.
yeah. It got to the point where we have like a charity called Samaritans over here, which is like the crisis line basically. So I looked at that online. I'm not someone to call, so I never called them, but they had this thing where it was like a journal app, which was quite interesting. It was basically just like a diary that they created, and I only ever used it once, and it was on that day. I remember it very specifically, where I had downloaded the app, gone through it, and I was like trying to almost search for like a lifeline basically, but like what can turn this around. And all it did was prompt you to write how you were feeling on that day. And I wrote exactly how I felt. And that day, looking at it, writing it out was one thing, reading it back was another. And then that was the point where I was like, oh yeah, this is crazy. We need to change this like right now. And then that's when you start the process of like then talking to my wife about it, because I was not doing that because we were already in a very stressful situation. Trying not to worry her and stuff, and then not talking to my family about it, and then eventually getting to the point where I go to the doctor, and a year or so later starting therapy, stuff like that. So that really was a turning point for me.
Wow, I'm so happy to hear that things turned around for you, because it sounds like things are going well now. Are you comfortable with me asking you like a couple more questions about that experience of yours? Because
yeah, sure.
Would you like context for why I want to know?
Can do, yeah. I'm sure that'd be interesting.
So just as a psychiatrist, I think that like, I think the hardest part of this journey, for many people, especially men, is actually before you show up in the doctor's office.
Mm-hmm.
So, I think once people like show up in my office, like in some ways, like the hardest battle has already been fought and won.
Yeah.
And I think we have a lot of guidance, or we have a lot of ideas about, okay, like once you show up in the office, what do we do? Right. So we have things like medications, and we have these like evidence-based psychotherapies and things like that. But like, I think the biggest challenge is actually like even getting there. And there's so many things that you said that I would love to hear more about, because I think that we know data-wise, there are a ton of men and women and non-binary persons who are going to be like going through exactly what you're going through. And it's something that we don't hear about, we don't talk about. And it's even something that as medical doctors, we're actually blind to, if that kind of makes sense, right? So we're like aware of what happens once you step into the office, but it's all that stuff that before that, getting there, that's actually like, I think can be incredibly helpful for people to understand. So I'd love to ask more about it, but if you're not comfortable sharing any piece, please let me know.
Okay, no, I'm fine with it so far, yeah.
So the first thing you said is that there's this thing called Samaritans, and they have a number that you can call, and you said, I'm not someone to call. Or like, I'm not someone who calls,
Yeah.
right? Can you tell me about that?
Okay. That's more of like a anxiety thing. Like I hate phone calls normally, which is weird because we're doing that now. But
Yeah.
like when it's in context of my job, it's way easier. Or if it's
Okay.
in like a Dan TDM context, I find it way easier. But in general, I have a lot of anxiety, like social anxiety. So it's not something I would, especially in that scenario as well. That's got to be like, I can't even imagine how that phone call would go. Like I wouldn't know how to say it from my mouth, but being able to write it down is way easier. I think that's the approach. That's kind of what I meant by that.
Okay. So when you say I have a lot of like anxiety, what does that mean? Like, what do you experience? What makes it hard for you
I
to call?
I don't I'm an overthinker, I think. So before a call, I will like try and plan out the whole conversation. Like, what are they gonna say? What do I reply? How do I say this? And then I know I'm not the best. I'm not the most eloquent person in the world, so I take a lot of time to think about what I'm gonna say. Sometimes I have long breaks in the way I think, and I just yeah, like now, like I'll just go blank sometimes and not know how to finish the sentence. So I have lots of anxiety over that. I'm thinking like, what are they thinking about me? Usually, if I've planned out even something like ringing the vets or something for my dog, I'll think about what I'm gonna say, and then plan it out. When they answer the phone, I've already forgotten it, and then I just like stumble. I just
Hmm.
have loads of like social anxiety over that. In
What's your
person as well, I'm not the most. I'm not like good at small talk, stuff like that.
what's your understanding of why your mind goes blank?
I think it's like a panic thing. Like I've done probably not enough, but I've done a decent amount of therapy where that would come up, and it's like because I'm trying so hard to think of what to say, it just like my mind is just gone. It's like blank. Like even things like when I take Asher to an appointment, for example, and they ask his date of birth, I'm like, oh, have a moment of self doubt, and I've just forgotten it. Like obviously I know it, but in that moment I can't recite it for some reason. It's weird.
Yeah.
I
I
think
mean,
that is a
go ahead.
I was gonna say I think that is like a side effect of anxious thoughts, I guess, being
Yeah.
anxious.
So it sounds like can you tell us a little bit about what you've learned in therapy about how to deal with that?
I mean, I should probably do more because it's still something I'm
Yeah.
dealing with.
I mean, everyone can do
Um,
more. I can do more, bro.
yeah. Um, I think it's more. I think of these scenarios. I think of worst case scenarios all the time. Like my thing is prepare for the worst and it won't happen, which isn't
Oh,
necessarily true.
pregnancy is impossible, man. No wonder.
Yeah,
You're
exactly.
fucked. Sorry. Does profanity bother you?
Uh, I no,
We'll,
but I
we'll,
don't normally.
we'll steer
I
clear
won't
of it.
swear.
Okay.
Okay, cool. Thank
A
you.
little bit may slip
Um,
out, but I'll work better.
no, you're good. This is your platform, so
Yeah.
I don't want to dictate. Um, yeah, so that's something that particular statement is what we worked a lot on in therapy. Is if you're always preparing for the worst to happen, you're going through maybe like four hundreds of scenarios at the same time, in your brain, and you just can't do that. It's impossible, which is why you then the thing you're anxious so the thing I'm anxious about is speaking, basically. So if I'm going over these hundreds of scenarios in my head and also trying to form a sentence out of my mouth, I'm actually causing the thing that I'm anxious about, if that
Yeah.
makes sense.
Yeah.
So it's
Yeah.
a lot about trying to rationalize your own thoughts and rationalize what maybe like other people are thinking about you as well. Something that I find helpful is swapping perspectives. So what if I was the other person in whatever scenario, what would I be thinking? And then that brings me a lot of clarity, I think.
Yeah. I think we know, if I can just kind of like offer a couple thoughts about that.
Hmm.
The first is that we know that people who are anxious tend to do something called ruminate, which means they kind of like spin around in their own head with their own thoughts.
Yeah.
And the more that they can step out of their mind. So oftentimes people who are anxious, on the one hand, they think a lot about what other people are thinking, but they
Yeah.
don't actually receive reassuring signals from other people. So like
Okay, yeah.
if someone else is like laughing at your joke, that won't reassure you because you're kind of stuck in your own head.
Yeah, that
And
makes sense.
so there's even it's so interesting because there's an evidence-based technique called mentalization-based therapy, which is specifically training people to step out of their heads and step into someone else's shoes. And it can really help with things like rumination.
Interesting.
The other really interesting thing that you kind of like are talking about is that, you know, speaking is a very natural thing. And so I don't know. I mean, one thing that I did just very little because I don't practice a whole lot anymore, but I started doing towards the end of my practice is asking people to do natural things intentionally. So a great example of this is like walking. So if you try to like control each muscle when you walk, you can't walk. Right? It's like,
Yeah.
okay, now let's lift my leg. Now let's bend my knee. Now let's bend my ankle. Now let's put my foot down. Now let's straighten my leg. And it just becomes an absolute train wreck. And what happens with people who are anxious is they do that for speaking. Right? So instead of just
that makes sense.
speaking, you're thinking like, okay, I have to say this, and then they're going to think this, and then you're playing through so many scenarios, and it does absolutely negatively, like it becomes a self-fulfilling prophecy, which then damages your confidence, and then you kind of...
Yeah, it's like a vicious cycle.
Yeah. So I think it's great that you've, you know, made some progress, and I think it's like, you know, you can always make more progress, dude.
Yeah.
The other crazy thing that I remember learning is that, so your stress state, I don't know how to say this. So I'll tell you a story if that's okay. I was working with someone who's an esports professional, and he used to like party quite a bit. And so when he was like practicing, what would happen is he would be like hungover the next day. And then he would like go to scrim matches and things like that. And then like he would like actually like do pretty well. And then when the actual tournament came around, he would, you know, his coach and stuff would be like, you can't party now. Right. So it's like the live match and there's millions of dollars on the line. So he would like stop partying, and his play actually got worse. And so it turns out that like he actually plays his best when because he's trained, he's practiced so much when he's like hungover, or maybe even like after going clubbing for a night, he'll like show up in the practice room and like play after not sleeping. That's actually when he plays his best. And so there's some really interesting research around how whenever you practice, the state of mind that you're in is the state of mind that you need to be in when you like recall. So when you're studying, if you are not staying up all night and then you pull an all-nighter before the test, your brain is in a different state, and it's actually harder to access the information. So you want to try to duplicate that kind of as much as possible and stay kind of consistent, which is really weird. But you know, anyway. So going back to this, so you were saying that, you know, you're pretty socially anxious. You're not someone to call. And then you also said that you didn't know what to say. Can you tell us a little bit about that?
Do you mean like in the context of if I did call, I wouldn't know what to say? I think it's more just like, even now, I wouldn't, the way I've explained, like the scenario that I was in, I can't say the specific words of what I want to say. So even now, I can't say it. I have to say it in like some kind of, what's the word? Like a cryptic kind of way. Like, you all know what I mean, but I can't say it. Like, I just can't.
Yeah. What's your understanding? How does that work? What do you...
I don't know. It's just like, because it's admitting, I mean, it's just admitting that you're in that state. I don't know.
What is that state?
Yeah, I don't know.
Can you hold on a second? I want to show you something.
Okay.
Let me just make sure I can find it. So give me just 1 second, okay?
Yeah, no worries.
Are you feel like, am I stressing you out or making you feel nervous or anything by...
No. This is all good.
What I'm going to do is screen share with you, and then I'm going to change. This is going to like take me a second, okay? So what I'm going to do is we're going to do, how did I figure this out? I think, do we have, this. So I'm going to screen share with you. I'd like to show you a scientific paper, if that's okay.
Okay.
Okay, so can you see my window?
Yeah, I can see it.
It's hilarious. I was like literally reading this stuff today.
Oh, really?
So what is the impact of men? Not this one. Boys don't cry. Not this one. Why didn't you just ask?
Yeah.
Right. Underestimating the discomfort of help seeking. This is the one. Okay, so measurement. No. Did I miss this? No, this is. Hold on. Here we go. Role of masculinity in help seeking. So let me find this. Here we go. Difficulty communicating. I'm going to just show you a quote, okay?
Here we go.
Difficulty communicating. So the notion that men are socially conditioned not to engage in emotion-based communication and consequently experience difficulty employing such language was a recurring theme in 82% of qualitative studies. It was suggested that help seeking is often hindered by a limited emotional vocabulary in men, which is maladaptive in therapeutic contexts. So like, this is crazy, right? So participants purportedly contradicted the influence of male ideals with participants not identifying as depressed and instead using terms like stressed or overwhelmed. So this is just like super wild, but I was thinking about, just what you were saying about, like, I wouldn't know what to say. And it's crazy, but like 82% of studies that look at men and why they don't ask for help suggests that, like, literally we do not know the words to use.
Yeah, 82% is so high.
That's 82% of studies. So the number of subjects that they were looking at was like, hundreds or thousands, you know. But it's like such a common experience that we just don't, like, we literally do not know what to say. Like, I don't know, like, if someone, and it's not like, and I think it's so interesting. I really wonder about the fact that Samaritans had an option for you to write.
Yeah.
And what kind of...
It wasn't even... what was interesting... Sorry to interrupt, but what was interesting about that is it wasn't even writing to someone. It was just a journal. It was literally something I could have done by grabbing a book and just writing in it, but I didn't. It was a really interesting way of like self-reflecting on your thoughts.
Yeah, and are you okay sharing a little bit of what you wrote that day?
Like I said, I just can't say it out loud. I don't know why.
It's
I know
weird,
what
right?
I wrote, and I alluded to it earlier, but I can't say. I just can't.
Okay, that's okay. Yeah, right. Yeah. So like, let me ask you this: if you're okay with, and let me know. I'm not going to ask you again what you wrote, but
sure.
Which part of you can't say it? Does that question make sense?
Not.
So is it that you can't come up with the words, or there's something inside you that's keeping you from sharing?
Oh no! I know the words. It's just something that I just can't say out loud.
Yeah, it's weird, right?
Yeah.
And so that's so like, yeah. I mean, that's very common. I can screen share another piece that relates to. So one is not knowing the words, and then the second, let's do it. Are you okay with that?
Yeah, sure.
Can we take a look at? So let me do this. Same paper. This is a great paper, by the way. We don't have to. These are all the studies that they looked at. Let me see if I can. Maybe a different paper. Yeah. Okay. So finally, those men that had sought help described experiences of limited disclosure, minimizing the severity of symptoms and the magnitude of need in order to maintain a masculine status. So like this is, let me see if there's more about limited disclosure. There's a different paper that goes into it more. Okay, I don't know which paper it is, but so there's another big theme here, which is that men especially are like, I guess I didn't screen share with other people, or they didn't see that. But so men especially are like, the biggest thing is that we want to limit our disclosure. So like, even if we do tell, and maybe this resonates with you, maybe it doesn't, but even if we do say something or we ask for help, we don't ask for everything that we need. We ask for the tiniest slice of what we need. Right. What I actually like, I want a meal, but instead I'll be like, yeah, I'll take, can I have 2 bites, or I'm a little bit hungry. Can I have a tiny little whatever?
Yeah. Yeah.
And so that there's something really powerful, right? So, and I think we're kind of seeing it here, which is that, like, even though you know what to say, I think cognitively on some level, you're comfortable with this conversation. Like we talked, before and stuff about what your boundaries are and all that good stuff. And so even though there's like, and this is that part of the conversation where we're going to steer clear of it, right? So and there's a part of you that still, like, you just can't say it. It's like crazy. Like,
yeah, I think I can't say it in an explicit sense, but like I said earlier, I didn't want to be here anymore. That is saying it, but not directly.
Yeah.
Like, that's not how I felt in that moment, as explicitly as I would have said it in that moment.
And I think every person who's watching knows exactly what you mean.
Yeah.
Right.
But I can't say that. I've only said those words to one person, and that would be my therapist.
Yeah. Right. So it's crazy. Like, not even your wife.
Not in that explicit sentence. No.
Are you comfortable? So now is the point in the conversation where I think we should, like, reevaluate our boundaries about what's okay to talk about, what's not okay to talk about. So you got to let me know. Okay. Because earlier we said nothing, but now I think there's something, and we have to respect that. Is that fair?
Okay, right. Yeah, you're fair.
So, are you comfortable exploring a little bit about why it's hard to even tell your wife, or maybe that's the hardest person to talk to?
I think part of it was maybe the time. Like, we'd just had a baby. She'd just been through this pretty traumatic birth, and she was a new parent. I was a new parent, and it seemed almost
burdensome.
Almost, yeah, burdensome or selfish even, to be like, I really need to, I need help now. Yeah.
Yeah.
That was why. I'm someone who doesn't like to bother other people. Like, another recent example is I had to have my appendix out recently, and it took me a lot to ring an ambulance when it was flaring up. Like, it's that same kind of mentality. I'm like, there's people that are worse than me, kind of thing. Like, people that have a way worse scenario, way worse life than me. So why do I feel this way? Surely I can just get out of it myself, kind of mentality. And I don't want to bother people. I don't want to seem extreme. Maybe it's not that or anything like that. It's that same kind of mentality. Like, oh, can I get over this pain, or do I really need help?
Do you really need help? Right? Is there any way? Is there like maybe I can get through it? Right?
Yeah, exactly.
And so what I'm curious about, like you mentioned earlier, that, sometimes you'll step outside of your head and into someone else's shoes. And if we were to do that for a moment, and someone else needs their appendix out, and I'm guessing that you had right lower quadrant pain that was excruciating.
Yeah. On the floor, can't move.
Cramped, curled into a ball.
Horrific, yeah.
What would you say to that person?
Ring an ambulance.
So what's different? What's different about you, right? Why do you get such special treatment? Yeah. What do you think? Why are you less deserving of help than other people?
I have no idea. Like, that's it, isn't it? I guess you want less deserving.
Well, I mean, somewhere you learn that, right? Do you have a sense of how long you've strived for independence and being kind of like not needing help from somebody else?
I guess I'm just someone who tries to do everything myself, like in anything. I mean, even if you chalk it down to YouTube, like I did YouTube myself for, I don't think I got an editor until I hit like 15 million or something like that.
Yeah.
Subs. So,
you mentioned you were doing your own thumbnails and everything.
Thumbnails, edits, literally everything. Like, I'm just not someone who asks for help that often. I guess that spills out into other things that are probably more important to ask for help for.
Yeah, but do you have a sense of how long? So it sounds like this was before. So this was already there when you started YouTube, right?
Yeah.
So do you remember how long? Like when you were a kid, was it okay, not okay to ask for help?
I probably didn't know. I don't even know the reason why. Like I wouldn't ask for help. It's just something that I've always been like, I can do this. Like I'm someone who would be like, I'm trying to think of an example. I could watch someone do something like a crazy drum solo. I don't play drums, but I could be like, I could do that. Eventually, I could do that. So I think about that in like every sense. So if like I had the ambition to make a game, my first thought would be, I will learn how to do it myself, rather than let's hire people who already know how to do it to then make a game together. I'm someone who would just be like, I'll just learn it myself and try. I'll fail, but
Yeah, it sounds on the one hand so respectable, right?
yeah, yeah. On the one hand, it's actually, I don't think that's a healthy mindset, but on one hand, it's actually benefited my career basically.
Yeah. And on the other hand, it sounds really isolating.
Yeah, yeah, true.
And
Hmm.
what else would you say is unhealthy about it?
Yeah, the isolating's a big thing because you don't even have like a team to talk to. I mean, I do now. Like, I have management and well, a close team.
Took you a
I have.
while.
It took me a while, yeah.
15 million. It's
Um,
like, oh, maybe I should hire someone at this point.
I mean, do you know what? Even now, I don't have full-time editors because I dip in and out of making videos. Like, I can't. I don't want the responsibility of hiring someone and then be like, yeah, I'm not making videos for like 5 months, by the way. Um,
Yeah.
so even then, I don't have like in terms of video creation, I don't have a permanent team. I have editors that I can trust and hire as I go, as I
Hmm.
come in and out of breaks. But yeah, I don't know. I just always felt like I can do this.
What's it like to not be able to do it?
um, I don't think that often, which is probably why it was so hard to ask in terms of like my mental health. So I'd still always convinced that I can. Like even now, I if we take the creating a game example, which is very different, but I think leads along the similar mindset. I still believe now that I could learn and eventually create a game. I reckon I could do that, but
I reckon you could too.
the, eventually, but there's only so much time in the day. Like you just can't you can't
Yeah.
do everything. But then when it comes to something as serious as like a mental or physical health, then you can't necessarily. You need to become a point where you have to admit that you can't.
How did you get there?
Uh, I with the mental stuff, it was that moment of reading back, probably
Yeah.
taking myself out of my own brain and reading it from like a third person perspective, being like, oh, if I read that from someone else, it was literally in that moment, it almost felt like I did leave my body and read it as if someone else had written it and be like, oh, yeah, you need help. You definitely need help. Because if
So,
anyone else showed me that, that's the response I would give.
okay. What was your, so it almost sounds like a touch dissociative, like you kind of stepped out of yourself for a second.
Yeah,
And,
yeah.
and what would be the response that you would give to someone else?
That I'd like to feel like I'm a good listener, so it'd be something that I'd be like, well, what is making you feel this way? And then realize it is as serious as it was, and then you have to reach out for professional help. That's how you get there. I was also a bit naive when it came to like therapy and stuff. Like I'd never used therapy before, never experienced it, never really talked about it, and I was very skeptical of therapy. I was like, well, how can they help you? They don't know you, but actually that's the positive. So after experiencing therapy, I felt a bit silly that I'd been so negative in my own mind about how therapy can benefit someone.
Yeah. So you said that they don't know you, right? So I think that's a very
Hmm.
common concern.
Yeah,
By the way, how are we doing? Is this conversation okay?
yeah, this is good. Yeah,
Okay.
it's fine.
And we'll both keep track of if it's not okay. Okay.
Yeah, yeah.
So what is the advantage of someone not knowing you? I think it's a beautiful.
Yeah, the advantage
That's
is
eloquent.
yeah. The advantage is just fresh perspective. They literally don't know you. They don't know anyone. This is you telling them all the information fresh. They don't know any of your family, anyone in the situations you're talking about. Then
It's private, huh?
it's 100%. It has to be private, I
Yeah.
guess. And especially in like a job like mine, I've been very protective over my privacy too. Like I feel like I don't have any sometimes. So coming down to a situation where it literally has to be private, then that's the only place I felt kind of like safe to fully open up, I guess.
And do you like, so I mean, I think I'm going to ask you a question that we all know the answer to, but so I imagine that it's easier to talk to a therapist than it is to talk to, let's say, like the person you're closest to, like your wife, for example. What makes it hard to talk to people that are close to you?
I think it's because there could be consequence to it. Like if you tell someone, I don't know, like if you don't want to be here anymore, then they could. There's part of my brain that's like, oh, would they find that offensive? Like, am I not worth being here for, kind of thing? So it's that small element of risk puts me off of doing it completely. Whereas in a therapist situation, there isn't that risk.
Yeah. And so I was a bit confused. What is the risk that you're worried about? So your anxious brain catastrophizes, right?
That someone would almost be offended.
That you're
that I want to go.
And help me understand that. How could someone be offended if you were suffering so much? And I know I'm
like my worst case.
Yeah,
my worst case scenario brain would be like, oh, if I don't want to be here anymore, then like they're not worth enough for me to stay. Does that make sense?
Yeah, I think
that would be like what my brain would think. They could think. If there's a small percentage chance that they could think that, then I'm not gonna say.
If you loved me more, you'd want to live.
Kind of, yeah.
It's like no profanity. It's scary.
Like, am I not good enough to be here?
Yeah, I think it sounds, on the one hand, crazy, and I use that word carefully, and on the other hand, like it kind of makes perfect sense, right? That's kind of where your mind is, that you're so kind of wrapped up in a certain way of thinking. And I think you did a beautiful job of sort of saying, when my brain is, you said something like, when my brain is in its worst state. Help me understand, because help us understand that. Is your brain not always the same?
I don't think so. I feel like I go through like waves of mentally stable and then feeling less stable. The way I explained it before doing therapy is like, imagine you're on a road and it splits off into 20 different directions and you've got to choose the right one. But the fog is very thick, so you can't actually decide the correct one. You're just kind of picking one and hoping. Whereas as I continued the therapy process, that fog would slowly lift, so you can see the natural, like the way you should go. That's how I imagine it visually.
Yeah. So I think that's beautiful. And by the way, you're very eloquent.
Thank you.
I think maybe not in a precise engineering sense, but it's very like artful. Like I can almost like get the storytelling vibe as opposed to like the precise vibe, if that kind of makes sense.
Yeah, I appreciate that, because I'm a very visual person. Like as I explain something, I'm explaining an image in my head. Like I can see the roads and stuff. So that's why I explain it that way, I guess.
So here's what I got from that, and you let me know if this feels right to you or not. But like, it's not even that. I mean, each of those roads is kind of like a valid road, right? So like even the less healthy ways of thinking are like a way to go down a path.
Yeah, I tried to avoid saying that when I was explaining it, because I know my therapist would be like, there's no wrong.
Yeah, right. So it's interesting. It feels valid, and you don't know which way. Like, and so it's kind of weird, but like even some of the thoughts that we would think are negative can actually lead us in the right direction. Yeah. So even being able to like articulate and put into this journaling app or whatever, and being able to read it, like even like, and if you look at that road at the very beginning, it looks really dark, right? Because it's kind of engaging with your negative thoughts. And so there's a part of us that maybe thinks like, oh, we shouldn't go down that road. But it turns out that sometimes like those roads, and you don't see that that's the road that you need to go down until the fog lifts.
Yeah, that's true. Yeah, you're right.
And so on the flip side, there are some roads that look really tempting when there's a bunch of fog. And so, like, oh, like, I don't want to be selfish. Like, come on, Dan. You don't want to be selfish.
Yeah.
Your wife just had a difficult birth. There's a newborn. No one's sleeping. Like there's like a baby and there's your wife and she just like had this kid. Like, you don't want to be selfish. Like, you're not here to be selfish. You're here to be the opposite.
Yeah, exactly.
And you're going through all this stuff, but like, it's not like you just gave birth.
That too, yeah.
And so it's almost like you don't deserve to. It doesn't make sense that you should need this much help. And if you need this
like
much
you don't
help,
deserve to feel that way, basically.
Yeah, right. You shouldn't feel that way.
Shouldn't, yeah.
Yeah. And so that makes a lot of sense. Like, I mean, I think if we ask, 100 people, like, who do you think deserves more help when someone just has a baby, the husband or the wife? Like, I think a lot of people will say, like, clearly, and husbands and wives will all agree that, the wife needs more help. I think it's very reasonable. And yet somehow that road looks reasonable for the first couple steps, but because of the fog can actually be a little bit, not right.
Yeah.
And I thought it was a beautiful analogy. I think it really captures a lot of that experience of and it, does what I say make sense to you? I mean,
Perfect
that's what I
sense.
heard in that. Yeah.
Yeah, envision it. Yeah.
I thought it was beautiful, dude.
Thank you.
Yeah. So it sounds like you did get help. And what was that help? And what did your wife understand about like what was going on? Because you must have communicated something to her.
Yeah, I mean, not fully, but she knows there's something wrong. Like, it's hard. You can't really hide that. You can do your best, but your whole
you can
aura,
do your
like,
best, right? You did your best.
Yeah, but it's still very obvious. Like, she would say my aura was just bad. Like, there was just a dark cloud over my head the whole time.
Wow.
That
perceptive.
Yeah, exactly. And then I think I can't even remember the exact moment. I think there was a time where I explained it, but not. It was like skirting around the subject, basically. I tried to tell her, but dampening it a little bit. Like, this is not as extreme as it sounds, but I do need a bit of help, basically. So she found me it wasn't a therapist, it was someone you could go to talk to, basically, but they wouldn't necessarily offer any techniques or advice. It was someone to just sound your thoughts to, basically. And then that was actually before, I can't remember when that was, but it went to like from in person to phone calls, and then to phone calls I found very different and inefficient.
Okay, interesting. But before we get into that, I'm a little bit curious about what she understood. So it sounds like you kind of, like any good classical research-oriented man, you limited your disclosure, right? And you downplayed things. But what's your sense of what she heard?
I guess I've never really asked, but I think maybe hers was from more of I mean, I don't want to speak on her behalf, but it was more of a perspective of, like, if this carries on, we can't work this out. Like, we can't live like this. It's with me being in the state that I was, it was damaging the relationship, I guess, to the point where she's just like, this isn't a relationship at the moment. Like, you're that dark cloud all the time, every day.
Yeah, that sounds bleak.
Yeah.
Right.
Yeah,
so like, I don't know if you hear it, but I hear a lot of residual self-judgment. Like, this is not a relationship. Like, whoa, that's like heavy. Yeah. Right. And
so it was to the point where I was like that every day. Like,
yeah. So I'd be honestly a little bit surprised if she saw it that that severely. Like, I'm not disputing, I mean, I've never met the woman, and I've known you for a solid 30 minutes at this point, but
Yeah.
but I just want to kind of call attention to, like, how, I mean, we're talking about her perception, but I think that's your perception of you.
Yeah, I think you're right. Yeah.
Yeah.
Yeah, maybe it is.
Right. It's
Yeah.
interesting. Like, cause I don't think that she was like, we don't have a relationship right now. Like, whoa, bro.
Yeah. Yeah, you're right.
I mean, you're too nice and good of a guy and caring, and I'm sure you were, changing diapers and whatnot.
Yeah, plenty of those.
So I think that's the dark cloud talking. But anyway, so it sounds like, but she understood that something, needed to be done, and it sounds like she was supportive.
Yeah, she initially found me the help and told me where to go, basically. I can't remember the exact word, but yeah, not a therapist. It was, I can't remember the other word, but someone I could go to that was at like a hospital environment, but they weren't a doctor. You could just
A peer
talk.
support
It was a place
specialist.
to talk. Yeah, something like that. I can't remember the exact word,
Okay.
but something like that.
Yeah.
And then that was okay. Good to actually learn how to say certain stuff out loud, I guess, which I'd never done before. Then it moved from face to face to phone call, again, to do with pandemic stuff. And I found that just way less, like, it wasn't even FaceTime, it was just purely voice. I found that way less effective because you can't, I don't know, I guess there's a difference between doing like a work meeting over Zoom than face to face. It's just not as constructive. So I stopped that for a bit, then it started to get worse again, and then I actually went to like a GP to get help. So I was like, that I don't know what else to do, so I'll go to a GP. Sounded that out, and
What did you say to the GP?
I
And if you
pretty
can't
much
say
all the
that,
stuff
that's fine too. It's just like,
no, I don't even know if I said that directly. I can't remember the conversation.
so you know why I'm asking what your words were, Dan? Like, I have a very specific reason, because like I think there's a lot of people who are listening who do not know, like literally they don't know the words.
Sure.
And if we can get, and I don't even know the words, right? Because I'm on the other side of the table.
Yeah.
Where, and because I'm a psychiatrist, I'm not a GP. So
Okay.
what happens is, like, GPs send me patients, and then we know what you're here for, right?
Yeah,
By the
true.
time you
Yeah.
show up, like, we know what's going on. So I think it's crazy, because when I was reading this research about like especially men, but this, by the way, this gender gap is shrinking. It's scary. But like literally, people do not know what to say.
Yeah. Yeah, I think when I went in there, I think I even said the word, like my chosen phrase is I don't want to be here anymore. That's
Okay.
my phrase. And I probably cried as well because I was just very teary at that point. And they're
Cool.
like, "Oh yeah." I think that's the main few like points they
Okay.
try and find out is, are you at risk and teary all the time? Like there's certain boxes you have to tick basically. And looking back, I don't know if it was the right approach, but I basically went straight on to antidepressants for
Okay.
9 or 10 months
And what makes you think that may have not been the right approach?
because now that I have done therapy, I would much rather have done it the other way around. And antidepressants are they're good, but there's also like side effects that come with it. It's quite an undertaking, I think. And I'm someone who would rather not put something in my body to fix something. I'd rather try anything but, basically. So in hindsight, I would rather have tried the other way around, but at that time it helped, so
Yeah.
I can't complain at all.
I think I know this may sound weird as a psychiatrist, but I too am not a huge fan of antidepressants.
Yeah.
And at the same time, I think they can be incredibly helpful, especially kind of early on. But like, I don't think they're a permanent solution for many
No, I
people.
don't think so.
But kind of going back to, so what would you say was the difference between like antidepressants and going to therapy?
In my experience, I'm sure other people feel, I mean, it's so individual. Like for some people, long-term antidepressants will work,
Yep.
some won't. But
I have
for me
patients like that.
personally, yeah, for me personally, it felt more of like just putting a plaster over something, like not actually. Yeah, that's the best way I can
Yeah.
describe it. Putting a plaster over something, and then when you stop taking the antidepressants, you for me, it was over 10 months, so I had come out of like that newborn fog anyway. We were allowed to go out now because the pandemic was not over, but you were allowed to do stuff. So I wouldn't have said all those thoughts were dealt with, but life had got better since. So it was easier when I came off the antidepressants to just kind of carry on.
Got it. So what I'm sort of hearing, and I think a plaster is a good way to kind of describe it. So there's, some some psychiatrists who really believe that the primary function of antidepressants is emotional numbing.
That makes, yeah.
And that's really what they do. I've seen varying, I don't think it's one or the other. I think there's highly individual responses. But what I'm also hearing is when you stop the antidepressants, the actual like objective stress level and your circumstances were somewhat better. So even though nothing was fixed, kind of your support system was maybe a little bit more robust. Or just you could leave the house, which sounds like is an important part of.
We're allowed.
Yeah.
Yeah.
And you've got a little stroller or whatever y'all call them in the UK.
Yeah.
But what do y'all call? Is it the thing that you
Pram? We call it a pram.
Pram, right? So you've got a pram and you're pushing the pram down in the park or whatever.
Exactly.
And then can you tell us a little bit, once again, if you don't want to, totally fine, just like what was your experience of therapy and how it helped you?
Yeah, I tried therapy maybe like a year or so after I came off antidepressants.
And what
So
prompted
again,
that?
I think we had another baby.
Okay.
So we had another baby, much better experience, but there was again just more stress, I guess, more worries, and then because this might not be the case, but the way I feel is like the antidepressants it hadn't have dealt with kind of like say 80% of my brain space. So then when you add something like a stressful life event and add that 20%, you're at 100. So
Right.
you're back where you were before. It was nowhere near as bad, but I noticed kind of like the warning signs. I was like, okay, I need some help here. And then actually, again, my wife found me a therapist, basically. Found me
What
a
were the
local
warning
therapist.
signs?
Just kind of like one of my main things was sleeping. Like the only thing I'd want to do is sleep because my brain's turned off, so I can sleep. If I'm not awake, I'm not thinking. So I'd rather be asleep. So as soon as like kids are in bed or anything, I wouldn't work or make videos. Or do anything, any of my hobbies. I would just sleep because
It's a way of not being
the
here.
brain was off, like a standby button. Yeah,
Yeah.
exactly.
And did she notice that something was off, and did she kind of prompt that conversation, or did you signal to her in some way that you needed help?
A bit of both. I think like when I said I needed help, she's like, yes.
Okay.
Obviously.
Yeah.
But, so there was that. Yeah. I think as well, just like again, the aura changed around me. Like I'm a very easygoing guy normally. Like I feel like I'm very down to earth, just easygoing, easy to get along with. So when I'm not that, it's quite obvious. Like I wouldn't entertain much conversation. I wasn't doing the stuff that I love. Like if I'm not doing like YouTube, for example, that's something that I've loved for so long, then there's something not quite right with my balance. I wasn't doing anything fun because I just didn't want to. So she noticed that. We know each other so well. We've known each other for so long that she noticed that and helped me take that step that I wouldn't have taken because I don't even know why.
Yeah, I was about
probably
to
from
ask.
the things we were talking about earlier. Yeah, it's a big task, a big step to take. So she helped me take that step, and then
You
I
would
was
have
like,
wanted
what,
to figure it out
let's
on your
try
own.
it. Yeah, pretty much.
Yeah. How did it feel to take that step?
I was super nervous. Like again, I was still quite skeptical of therapy, but I was like, you know what, I don't want to go on antidepressants again because of certain side effects. So I was like, you know what, let's just try this. Let's try it. It's not as bad as before, but let's try it. And then as I started therapy, there was actually way more below the surface that I needed to untangle and deal with to be able to bring just like my base thinking level, like my base thinking rate just down. Like I always felt like my brain was running at 100% all the time. So if there's another stressful event, then you're at capacity already.
Yeah.
Whereas therapy allowed me to decode all the stuff, even from like childhood and onwards, to then set my brain at a much lower level so I can deal with the more stressful stuff much easier and in a much more logical way.
Once again, just beautifully eloquent, man. So like there's a lot of stuff here that I love, which I'm going to toss back at you. So the first is I love the way that you describe it as like, not even like, I mean, you said, you know, some stuff from your childhood, but I think oftentimes we kind of think about like therapy actually in a very like feminine way, which is like, you know, trauma and feelings. And then, but I think it's actually really cool how you kind of talk about just this pace of your mind. Like you talked about slowing down your baseline activity. And then what happens is you build reserve. Like that's what I'm hearing, is that you're so close to like the edge of the cliff, right? That just a little push, like kind of pushes you really close to the edge, and then you're kind of hanging on, and then you're kind of falling off, and that you're always close to the edge. Like you're always like kind of at maximum stress. You know, I mean, I think about this as almost like there's a difference between like walking and then you can run. Like you can increase how fast you move if there is a period of stress. But if you're kind of huffing and puffing, and then like a bear shows up and you're getting chased, like you can't run any faster. Like you're already at your limit.
That's exactly it. Yeah.
And I think it's cool how you sort of describe like therapy is not, I mean, I'm sure there's talking about feelings, and you mentioned there was like, you know, some stuff like in there, but really the way that you view that is that it sounds like you were kind of sitting with a lot and really using up a lot of your reserve at baseline.
Yeah. And sometimes even stuff you don't even realize, like just stuff that has happened to you before, and then it's taking up, it changes the way you think and deal with stuff, which is then increasing your mental load. Whereas if you unpacked it properly and then change the way you think about certain situations, your mental load is, or you're then working at getting your brain to work at that lower baseline.
Yeah. So I think this is too good of an opportunity to pass up. So I have to ask, can you give us an example? Like, and if it's not comfortable, that's totally fine. But like, I love the way you're mapping out this principle. And I want people who are listening to, if you're comfortable with it, have the opportunity to like see what you practically mean. Right. Because I love it so much. As a therapist, I love the way you're describing it.
Right. Okay. Yeah. I can think of one example. The main example in my life is when my parents divorced. So that is pretty much, me and my therapist work together, and they're like, this is where this prepare for the worst and it won't happen kind of thing. That's where that stems from, because as a kid, I was very under the illusion that my family life was fine. Like everything was okay. And then all of a sudden, bam, like they're splitting up. And then we had to move to a different place, and then wouldn't see my dad every day, and then see him like every other weekend. Like that was a huge, felt catastrophic at the time. And then that is just, and I didn't realize it until I went to therapy, that how catastrophic that was for my mindset moving forwards. Like that's a huge reason as to why I think or prepare for the worst at any moment, because that seemed to come out of nowhere. Obviously it didn't, and they were dealing with it. My parents were dealing with it by themselves and not like bothering me with that information. Then when it all came out at once, that just like completely uprooted my world. So
what was it? What you said, it was catastrophic for your thinking? How so?
I think because before that point, I didn't even think about that stuff. And then you realize after all this time, like it's been maybe like a year or so of them really, maybe even longer, I don't even know, but what you thought was okay the whole time actually wasn't. That in my mind was just like, oh, so what else am I missing that seems okay but actually isn't?
Yeah.
And then as you then grow as a person, adult, it's a recurring cycle. You just don't get out of that cycle of way of thinking.
Yeah. So if I'm hearing you right, and you know, I've seen this a lot, it's kind of like, you know, if you assume that something is stable and your mind is like, we don't have to worry about that. And then you wake up one day and it's like, oh crap, we were wrong. This thing that we thought we could be calm about, we can't be calm about.
Yeah.
And then that creates go ahead.
I was gonna say, and it wasn't something smaller like my car broke or something. It was like parents completely separate and we have to move to completely different locations, and the whole way your life works at that time, everything is going to change, literally everything. So it's just that kind of mindset combined with the severity of the impact on my life. Just
So I'm hearing that you were blindsided by quite the uprooting. And then if you really think about it, right? So if it's like waking up one day and realizing, oh, gravity is flipped upside down. It just completely messes up your life. And then the other really interesting thing, I mean, I think we see this is, common, is that you get trained for anxiety because now you can't rely on reassuring signals, because what if you're wrong?
Yeah.
Right? Like, we don't want this to happen. Like with this, we got caught off guard once. It completely uprooted our life. We cannot get caught with our pants down again.
Exactly.
And so you're constantly questioning. Even when things are okay, you can't leave it alone.
Yeah. It's like there's this song I used to listen to where it's like, I'm terrified it's going good. And that's always stuck with me, because you're like, oh, you know what? Life's pretty good right now. When does it go wrong?
Yeah, no.
Well,
so well said, man. Because like that's crazy. Yeah. I mean, one of the things that I see a lot with people that I work with is like, things that are going well become sources of fear. And when things going well become sources of fear, there's no escape for fear. Bad things are scary and good things are scary, which means that you're constantly scared.
Yeah. And then it comes back to that, when bad stuff does happen, which is going to happen at some point, you don't have the space to deal with it. Like you're already operating at a completely everything's bad mindset. So if you haven't enjoyed the good time, you're not gonna be able to deal with whatever bad stuff happens.
So well said, right? Because you're stressing out about everything going well. You've got no bandwidth left. You're at your limit. Yeah. I think just one other thing that I thought was interesting. So it sounds like your parents didn't burden you with what was going on in there. Yeah. So maybe that's where you learned it.
As soon as I said that, I was like,
this is a guy who's been to therapy. It's like, you got it too, right? Yeah.
Those are actually some of my favorite moments in therapy, because as you're saying it, it comes out your mouth. You figure it out before they've even responded. I used to love that, because I think that shows you're making progress, but also you're like, you already knew it almost sometimes. Like the information was there. You could connect the dots, but you just need someone to guide you at the same time.
Well, I think that I would modify that a bit. I think you're right that the information is there, but you couldn't connect the dots. So I think you're a very good example of how putting things outside of your mind, either through written stuff like journaling or whatever prompt you filled out, or even saying it out loud. So it's really interesting how this works in our brain. But, when we speak, it engages our auditory cortex. So when we speak, this actually becomes an input that our mind reflects on. I don't know if that kind of makes sense. But like literally, like there's this part of our brain called the thalamus. And the thalamus is what brings in stuff from the outside. And when we bring in stuff from the outside, we evaluate it with certain there's certain like evaluation circuits that apply to sensory stimuli. Those same evaluation circuits do not activate when we're thinking, because it's it's like our own thoughts. So like it doesn't go, it's like literally like a different input in our brain. And so when we say something out loud, like you connected the dots, right? Like I connected the dots. I'm sure, people who are familiar with this, who are listening, also connected the dots. But that's really what it lets you do, is it lets you connect the dots in a way that it's very hard to understand. You just can't do that in your mind in the same way.
Yeah.
And it's literally because the brain circuits for thinking and receiving information from the outside are different. And when we receive information from the outside, our brain processes it in a different way. So cool. So it sounds like, you made a lot of progress. it sounds like you've gotten better at understanding yourself. You really like worked on some of that stuff, so you've got a lot more bandwidth.
Yeah.
And you said something like, now you really understand the importance of breaks. It sounds like you took an extended break. Like, how did you get to where you are now with that?
I was trying to think earlier when you asked me about introducing breaks, where I took my first like jump, where I was like, oh, I'm just going to not make anything, because I've never done that. I can't remember when it was. It must have been. I can't remember when the first extended break was, but that was probably only like maybe a month or so. And then, but I've never taken one this long before, like from what was it, like January to May, pretty much. But I think the main difference is just having my kids. Like, if I don't want to sit in this room, this dark room, making videos when my kids are upstairs growing up. Like, this is the early parts of their life. Like, I'm lucky enough to be able to do what I want when I want, basically. So I need to take advantage of that and actually be there for my kids and watch them grow up. And I just wanted to do that more than making videos, really.
Yeah.
That's putting it simply. I just wanted to be there.
Well, would that have been hard for you earlier?
Yeah, 100%. And that was one of the big struggles that came with having a baby in the first place. Like, our first is I spent 6 years or so only doing YouTube. Like, that's it. YouTube was everything, like content. That's all I'd think about. That's all I would do. So then going from that down to one video a day from two was a big jump. And then the other jump was going from one video to a different schedule, like one video a day. Leaving out days was just like, oh, I'm going to ruin the consistency. It was such a big thing of my growth that if I'm not consistent, it's just going to ruin everything.
Yeah.
But again, that's probably where the worst case scenario, I'm like, oh, if this happens,
that's interesting.
the worst that can happen.
Look at you articulating things and making connections. That thalamus is firing, baby. Like, it's so interesting, right? Yeah, well done.
Therapy is good.
Yeah. And one other thing I just want to point out, I can't leave this unaddressed, but we should go back to it. I think it's really cool because this is what I love to see when I work with someone, is the goal of therapy is to no longer need therapy. And some people sort of, like, in a sense, need it their whole life, which I think is okay. I don't judge that. I think that just has to do with the hand that you were dealt more so than your capability.
Yeah.
But I think what I really like about being a therapist is, like, when I work with patients and they're able to do exactly what you're doing, which is like you teach skills. And the goal is actually independence. And I think we can see it, like, it's so beautiful to see in real time. And I don't know who your therapist was, but they were awesome. And you put in the work, and you can really see it. But so it sounds like you were. I thought it was cool to see. Like, it makes me happy on the inside to see you kind of connect those dots. And
Nice.
it's fun. It's fun. Go ahead.
I was just gonna say, the way I again visualize the way therapy works is they like hand you the manual for your brain almost, and that's how, like, we don't get given one of those, but going through therapy you kind of learn that. That's how I thought about it, is you're learning how your brain makes those decisions and why they have, depending on what has happened to you in your life, or good or bad, and then you get that manual to deal with your specific brain. That's how I think about it.
Yeah, I think it's beautiful. Like, so I completely agree that we're not. So that's part of what we try to make in terms of our content, is we try to teach people. So the papers that I showed you today, I'm working on a video or a lecture on why men don't ask for help.
Yeah.
And there is a manual to that. There are reasons that this is like a uniform experience, especially for men. Or the male type is different. There are additional reasons why women don't ask for help, and there are many reasons why no one asks for, or there are many reasons why everyone doesn't ask for help. So, and you're right that there are manuals that we can learn about, and then, like, there's like the general manual, and then there's like 4R model, and both of those are, I think, one we can do through a lecture, the general model, but then the model that's specific to you, your particular limited edition, Dan, you need to work with an individual oftentimes. And so it sounds like you were able to, but how were you able to, for someone who's worked so hard, are you kind of aware of the process of like what you had to do internally to like take a break?
I think so. It's more, I just kind of bit the bullet, I guess. There's always that, especially specific to YouTube. It's a common thing that I spoke to lots of other content creators about is will I be able to come back? I'm consistently doing my thing now. If I take even just a week's break sometimes for some people, or even yeah, for me back in the day, saying take a week's break, I'd be like no, because it just upsets the rhythm of everything. And then you're like, well, if I do that to take my week's break, then cool. But what if then I can't come back to it? Like I've ruined it, the whole thing. And that's really common kind of mentality in YouTube and content creation in general. So for me, I do feel lucky that I have people that care enough about me and my videos for me to be able to come back.
Yeah.
Especially like my most recent one, where I came back, made a Minecraft video after like a year at least of not making Minecraft videos, and for people to be like, "This is awesome, we missed you," kind of thing. I am very lucky to be able to do that because I know
Yeah.
a lot of people, like some people, just can't. I don't know why that is, but that is always a very big concern for people when taking breaks, which is why we get this unhealthy cycle of just having to pump out content all the time. But then at the same time, you can't make your best content unless you take breaks. So
Yeah,
and then
it's
again
a
with the
huge problem.
space thing, like you can't be creative if you don't have the space for it, or if you're forcing it, that's you can't do that.
I think you used a great word, pump out, right?
Yeah.
There's a difference between making content or like creating storytelling and pumping out content.
Yeah.
You know, I worked with someone once who told me that they really hate the word content because it's so
Yeah.
lifeless. It's like, what is it? Is it
True. Yeah.
written? Is it video? Is it music? It's like such a lifeless, generic, kind of term. And so that, yeah, that's super cool. And I think, I think we sometimes underestimate the power of communities. And like,
Yeah.
I think there's a very one-way perception of content creation, which is like there's the content creator and then there's the audience. But like, I think that there's a very back and forth, and that like the audience like matters a lot. Like the
Yeah.
community matters a lot. And what is created is really like a lot more organic between two entities than just like one person who's disseminating and one person who's receiving, or a group
Yeah.
of
I think
people who.
Yeah, I think you're right. I guess there is a difference between, say, if you're a content creator that does just pump out content, and then there's none of that community building, then if you did take a month break, you won't be able to come back because there's no community for you to
Yeah.
be excited about coming back. Whereas I guess for a long time, I developed a community of people that do want to see what I make, regardless of how long it takes me to make that content, whether it's through just making videos or then doing the extra stuff like the touring and the meet and greets that I used to do so much that people really connected with. So yeah, I think you're right. There is a difference between the type of content that can maybe take long established breaks and come back, and not just in the way that you approach it.
It's interesting. So for me, my thalamus just connected those dots. That I wonder if so when we work with content creators, we have like a content creator coaching program. So we worked
Cool.
with about 500 content creators, and of all sizes. And I a lot of a very common problem is like people feel like they can't take a break.
Hmm.
And one of the things that we haven't quite looked into yet, but I think I'm going to now very actively, is like understanding that your capacity to take a break, it depends on community. And
Yeah,
the
I think
bigger
you're right.
or not the bigger, but the better your relationship with your community, the easier it will be to take a break.
Yeah, agreed.
Yeah, so I'm kind of like, let me just take a quick look. I think everything that I have thought about to ask you, I've asked at this point. I think we've been doing this for about 90 minutes. We kind of started like kind of right on
Okay,
time.
sweet.
So I'd like to leave some space for you. Like, I think it's a beautiful story that you've told us, and like it feels somewhat complete to me. Like we started off with like, yeah, I haven't taken a break in a long time. And then we like talked about this, and then we talked about this, and you had kids. And by the way, the other thing that you could have done in addition to potentially medication or therapy, because what triggered your second challenge is you had another baby. So you could, just avoid doing that. You could be celibate, and that could have fixed your problems too. Right. But yeah, so I it feels like the story is kind of like at a decent start and an end to me. It doesn't mean that the conversation has to be over, but I want to give you space if there's questions that you have or things that you wanted to talk about. Like, I feel like I've been driving for 90 minutes and I want to give you a chance to drive if you want to, or we can kind of wrap up whatever you feel comfortable with.
Yeah, I'm not sure if, like you said, I think we've covered everything I'd wanted to have talked about. I guess one thing would be, we've talked a lot about therapy and how beneficial it is, but obviously it's not that accessible for a lot of people that maybe do need it. So what kind of approach could people take that can't afford it, I guess, can't afford therapy when it is something that is so beneficial? What are the steps you could take? Like over here we have the NHS, but at the same time it takes a couple years to get even looked at for therapy and stuff like that. So what advice would you give to people that feel like they need that extra help but can't access it, I guess?
Yeah, so I think that that's a great question, and that was the question that got me into what I do today.
Oh, wow. Okay, cool.
So like as a psychiatrist, what I saw was like, I can help the people in my office. But what I quickly realized is that the number of people who need help far outweighs the number of people who I can see in my office.
Oh, yeah.
So a psychiatrist works, I mean, if you do therapy like I do, and, if you do like 15-minute medication visits, then you can see a bunch of people. But, I would work with maybe about 30 to 50 patients at a time when I was like a full-time clinician. And so I was just like doing the math, right? So if I'm working with like 50 people at a time, I see, I work with them for about a year. If I work for 40 years, that means I can help 2,000 people.
Yeah.
And like more than 2,000 people need help. Yeah. So, and there's even, institutions like the NHS, the United Nations, even like the U.S. Department of Public Health and things like that. We all recognize that mental health in some way is a labor problem. There are just not enough people out there. And that's just in developed countries. So this is not even including places like Eritrea, Ethiopia, Zimbabwe, the Philippines, Laos, Cambodia. Like there are just so many parts of the world, Argentina, where you don't have like, it's not just that there aren't enough, it's like there are none or very, very few. So then the question becomes, what do we do? And I think like my answer is exactly what we're doing here. So the first thing is that I think that you can teach people the manual, the generic manual. So I think that we haven't as a society taught people like how they work. So that's why we try to have all these like videos and stuff like that. There's a very preliminary retrospective data analysis that we did. So if you look at medication or therapy, it leads to somewhere between a 30 to 60% improvement is kind of what you get.
Okay.
So we did a very preliminary analysis, and it's not like a formal study that we've run. We're trying to structure a study to see if this initial finding is correct. So I want people to take this with a big grain of salt. But even watching our content can lead to like a 10% improvement.
Oh, wow.
So and chances are that the improvement is much higher in some people and much lower in other people. But like, I'll take it, right? So we'll do that. One of the things that I'm really proud of is that we do have like clients in 121 countries. So we're reaching those corners of the world where there's like nothing else. And like, that's the power of things like Twitch and YouTube, is like you can get to places where there is no infrastructure.
Yeah.
So I would say And then the third thing that we all, and this is the reason that we did it, is we started a peer support coaching program. And the reason that we did that is that, like, you know, the number of years, it takes about 8 years to train a psychiatrist. It takes about 5 to 6 to train a psychologist. You can work with like a licensed clinical social worker in like 3 to 4. So if you look at some of these things, like maybe that first person that you talked to, because you said they weren't a therapist, right? So that's like using the peer support model. Mm-hmm. That model has been shown to be incredibly effective. Alcoholics Anonymous is a great example of that model, where you don't have to have a formal workforce that's been training for almost a decade in order to help people. Human beings can help other human beings. I think you even alluded to this when you were kind of saying, you know, when I had a kid, it's a tribe. It takes a village to raise a kid.
Takes a village, yeah.
So there's a lot of stuff like that. So I think that's like literally the work that we're doing, because I agree with you that some people are very lucky and they have access to resources, but people who are not lucky, like, how do you bridge that gap? That's what we're trying to do. This is the best answer that I've come up with.
Yeah, it's a great thing that you're doing, for sure.
Yeah, I'd like to think so. You know, we'll see. But, you know, we've run a couple of studies and things like that, and it looks like our outcomes are good. But I think it kind of goes back to what you were saying, is that a lot of this is just, we don't know how to deal with it. So if you don't have access to a therapy, I think you're a great example of the difference between when you know what the manual says and when you don't know what the manual says. And that therapy, I think, is a very fast way to learn it if you find a good therapist. But then, like, also some of these principles you don't have to learn through therapy.
Yeah.
So for me, for example, I spent a lot of time studying to become a monk, and I think I got a lot of this stuff there. I've done therapy for a relatively brief period of time as part of my training, but I think it's like an important thing to do even as a therapist. So you kind of get both sides of it. And like, that was still incredibly useful. Like, despite the fact that I studied in India to become a monk for a while, and then like I came back and working with a therapist, like, helped me a lot too. And so I think that we've got to learn the manual. Like, we've got to disseminate the manual, and that's like a great place to start. But I would not discourage anyone who has the opportunity for therapy to like go see a therapist. I don't think. Yeah. And there are some people who have had negative experiences with therapy, and I think it is important to keep in mind that it doesn't work for everyone, or the particular set of therapists that people will see don't work for them. And I do think there are a lot of things that can improve our mental health that don't have to be talk therapy. So there's even research about this, that if you look at like studies on trauma, like a lot of this stuff is actually quite physical. Yeah. So I think we underutilize the body as a way of processing emotions and healing the mind. Or we think about emotions as mental, but they're not. They're like at least 50% physical. So there are a lot of these techniques that are kind of like pseudoscientific. Like, some of them now have research support, but they definitely started off as pseudoscience. Things like emotional freedom technique and even things like yoga and Tai Chi, these things used to be considered pseudoscience.
Right, okay.
But I think especially for dudes, like, we can use our body. Like, you know, the advice that we'll get is, if you go through a breakup, like, hit the gym, bro.
Hit the gym, yeah.
And I think there's a reason for that, right? There's some people have figured out that this is somehow therapeutic. And so I think we have a lot to learn.
Yeah, I think I almost brought the point up earlier when you were saying about how when something comes out of your mouth, rather than, even if it's the same thing you've been thinking about in your brain, it just changes the way you think about it. So I know we always, like, a lot of people say, just talk. Like, I feel like we don't do that still. Like, people say to do it, but they don't actually. And I'm guilty of it too, where you just don't want to burden people with your issues. But it helps so much if you have a trusted person that you can just talk all your thoughts about, or talk all your thoughts about too.
Yeah, absolutely. And I think the last thing that we also did was like, so I think another big part of this solution is like, I don't know if this kind of makes sense to you, but I'm like super optimistic for your kids. So for your kids to have a dad like you, I think is like top notch. So I think a lot of mental health stuff, seriously, I'm not saying it to, you know, glaze or whatever the kids say nowadays. It's not because of your Riz. But it really, I think that there was, you know, it's not that parents are like, so it sounds like your parents weren't aware of the impact of their divorce on you. I'm not saying they're bad by any means, so please don't hear that. It's just,
No, of course.
they hadn't read the manual.
Yeah.
And so the first book that I wrote may sound kind of weird because the majority of our audience is like people in their like late 20s. Maybe that's the average age now. But, I wrote a book on raising children, especially with like technology. So how do you raise children to have a healthy relationship with technology? And I think the single most impactful thing that I can do is empower parents to protect their children from the harmful effects of technology, because that will work at a generational level.
Yeah, 100%.
And I think the methodologies in the book are really good. I find that oftentimes, people who are like familiar with gaming, sort of like they don't need the book quite as much as like parents who don't game as much. But it teaches a lot of really solid like communication skills, which especially like dads, I think we don't have great. Like we don't always know how to speak and how to listen. And it sounds like your wife did a phenomenal job of like taking what very little you said and really understanding what you meant. And so it's really trying to teach some of those skills. And so I think that's really good. The really interesting thing is we've heard a lot of positive feedback from people who don't even have kids, that some of the core communication skills in the book are very helpful at like dealing with husbands who play too many video games, or wives who play too many video games, or siblings who play too many video games. And just like it teaches people like some of the manual of like communication and healthy relationships with technology. So that's the last thing.
Yeah. It's interesting you say that, because like a lot of the stuff that you go over in therapy is similar to it's called something like gentle parenting for kids. And I mean, my wife was the biggest. I've learned a lot from my wife about that, and that's how we've taken the approach to raise our kids. But then you go into therapy and you're like, this is just gentle parenting, like myself.
Yeah.
there's a lot of crossover there. I found really interesting.
Yeah, so I think gentle parenting is fantastic. I think the biggest problem with it is that it doesn't mean the same thing to everyone.
Yeah, I think you're right. Yeah.
So it's not very well defined, which is why like we're not actually sure like how effective some of this stuff is, because it means all kinds of stuff, especially if you get your gentle parenting tips from TikTok, which can be wildly variable. But yeah, I think that's well said.
And there are parts of it that are very difficult to implement correctly as well, I think. And my wife is very, very good at being able to study and understand that side of parenting and then pass the info to me, whereas I'm not great at that. So, but what I have learned is implementing that can be very difficult, but if you get it right, then it's very beneficial. In the same way that you think about yourself in therapy and the way you treat yourself, basically.
Yeah. Can you give me an example of something that was hard to implement, but you found to be very beneficial?
Trying to think of a specific example. I think when you're dealing with kids, it's more, I mean, it's the same thing, kind of taking yourself out of that situation and putting yourself into their shoes, especially at an age of like 3, for example. Like their brains are completely different to ours. I think a lot of people do forget that.
Yeah.
That even though my son seems to be, I mean, he can perfectly communicate anything. He's a little human. He's fully operational, but he's 4. So you need to understand that his emotional development is completely different to ours. So the way we see a situation is so different. So that's something that's helped me massively in dealing with certain difficult parenting situations, is be like, okay, let's think about it from his perspective. Like, why is this so important to him, even if it seems very unimportant to an adult? Is that making sense?
Yeah, I think it makes a lot of sense. So
Cool.
I think with your standard eloquency, so here's kind of like, I think one of the worst things that I've seen as a psychiatrist is when parents treat children like miniature adults.
Yeah.
So they're not miniature adults, they're children. And, one example that I can think of is like oftentimes parents don't realize when their child is tired. So we'll like focus on behaviors. Like if a child does something mean or hits you or throws something or throws a temper tantrum, like, we'll say like it's not okay to throw temper tantrums, and therefore we'll punish the child when the child does something bad, which on the one hand is like kind of okay, but oftentimes we forget as parents that the child is fatigued. Like their brain doesn't have the same stamina that our brain has. My ability to not throw a temper tantrum at 6 p.m. when I am okay with 8 hours of sleep a night is different from a baby's, like, a child's brain, which just gets fatigued and they just don't have they've got nothing left in the tank to regulate their own behavior.
Yeah.
That has to be balanced with a child still has to learn how to regulate. They can't, they're not always going to be well rested. So they have to learn how to restrain themselves even when they're fatigued. But I think that's like a really good kind of nuance to that I would say I kind of completely agree with. It sounds like your wife is super knowledgeable and
she is. She's incredible.
Yeah.
I think as well when it comes to that like development thing, like when they're super young, like my son, like Miles, he's 1.5, so he's getting to that frustrated age. I think a lot of what adults see kids as being naughty is like not. It's actually expression. So if he's frustrated and throws something and it hits you, that's him expressing himself in the way that he
knows
can
how.
understand that he doesn't. Yeah, exactly. Yeah, so I think there's a lot of learning that needs to be done in that kind of relationship. I think it's maybe just a generation above, whereas like my parents would probably view that as like naughty behavior, when actually if you try and understand it from their level, it's completely different.
Yeah.
Most of the time.
Well said. Yeah, so I think I completely agree with you. I mean, that's why it's kind of weird, because even though, our main audience is not parents, like that's what we chose to focus on, precisely because there are, especially the way that technology interferes with children's brains and, teenagers' brains and stuff like that, is like, there's a whole different layer of like, now this is this weird part of the manual where we've got like a flat tire, it's not regular operation.
That's going to be tough. Like when they get to like teen age, like even when I was a teenager, there wasn't internet on your phones. Like the development of technology in the time that I've been from teenager to now isn't that long, but it's been ridiculous.
Yeah.
But trying to navigate that when they're older is going to be interesting as someone who hasn't experienced like technology and the internet like that as a teenager. So that's gonna be tough.
Yeah. So I think there's some movement. So the Surgeon General of the United States just had a really interesting op-ed where they were talking about putting like a warning label on social media platforms, kind of like what we have on like cigarettes. There's some people who advocate for like people are now trying to ban cell phones in school and like.
I think we have that over here.
Yeah.
If not now, soon.
So I think we're starting to wake up to some of these dangers, and so what I tried to do is like, I'm not the government, so I just wrote a book for parents, and so we're doing what we can. But that's awesome. Do your kids play games?
So, not currently. Ash's personality type is he will fixate on a screen. So if he sees a screen, like the rest of him is turned off, like there's no other, it's just zombie mode basically. Yeah. And he played like Mario Kart for a bit, then we saw some unhealthy behaviors where he was like, he really wants to play Mario Kart. So we just slowly phased it out. Now he doesn't miss it. Like he does other stuff like play outside, or it was like an educational game he was playing today, but there's no extended amount of Switch time, for example, because we just saw an unhealthy behavior, and he's still young. Like he doesn't know how to operate it properly. All of the Mario Kart stuff is all automated. So is he really operating it anyway? I don't think he's old enough yet, but we will have to cross that bridge at some point, especially when his dad plays video games every day. So
yeah. So I tried to teach my older daughter how to play Mario Kart when she was 2.5, and didn't really work out. Now they're solid, healthy gamers. So they'll play for a couple hours, a couple times a week, and we tend to have fun with it. And
that's healthy. Yeah,
they're
for
good.
Sure.
They're good with it. So, but we'll see. Nice. I caught my kid playing Switch when she wasn't supposed to be, like yesterday afternoon. But then she told me that she got permission from another caregiver in the house, so that turned out to be okay. I was like, you're not supposed to be
I
doing
see.
that. No, but she's like, I got permission. I was like, okay, fine.
Nice. The smart way.
Yeah. So that's awesome, man. Thank you so much for coming. Any other questions before we wrap up for the day?
I think that's it. Yeah. I really enjoyed this conversation. Thank you for having
Likewise,
me
dude.
on. It's been a pleasure.
Yeah, I mean, I really, I know it's hilarious. I mean, not hilarious. I totally get where you come from in terms of like not feeling like you're eloquent, but I absolutely loved the way that you described your experience. Thank you so much for sharing that, because I think it'll resonate with so many people. I can guarantee you that there are people who are going to watch this and be like, I'm like that. And I say it as
Thank
someone
you,
who like,
yeah.
I was like that, right? Like, I mean, I didn't even, we didn't go into that. We didn't need to, but you know, I think oftentimes we don't know what we're experiencing. We don't really know when we need help. We feel like we have to be able to handle it on our own. Especially for men, we view asking for help. So we think that there's independent. And we think that asking for help is not a part of independence.
Yeah.
Right? So like if I'm asking for help, I'm not independent. The really fascinating thing is if you look at the research, people who ask for help become more independent over time. And when you ask for help, it is actually a problem-solving behavior that allows you to achieve a goal.
Yeah.
And so it's really fascinating. But thank you so much for coming today, Dan. Good luck with parenting and all that good stuff.
Thanks. You too.
I think seriously, your parents are lucky. I mean, your kids are lucky to have parents like y'all.
That's very kind of you. Thank you.
And welcome back to making content, and looking forward to what you make, man.
Back. Thanks.
All right, take care, buddy.
Yeah, you too. Thank you very much.
Oh yeah, we should probably send him a copy of the book. Hold on. Let me see if we can. Hold on a second. We should probably do that. I should have said that before I kicked him off. Anyway. Okay. So that was fun. Yeah. So if you guys, are young parents and y'all want to know what to do with tech, definitely check. Oh, okay. He's got one. Okay. So it looks like he already got it. Interesting. Maybe he purchased it. Fascinating. Then we should have asked him what he thought about it. But anyway, that's all. Whatever. Okay, so thank you all so much for coming today. I think hopefully that was helpful for y'all. I absolutely amazing dude. Amazing dude. A couple of things that I just want to kind of highlight. The first is that one of the things that we know about illness in general. So I was about to say mental illness, but it's true of physical illness as well. So there are correlations between socioeconomic status and illness. So generally speaking, if you are poor, if you're an ethnic minority, if you have fewer resources, you are more vulnerable. If you're an immigrant, you are more vulnerable to certain kinds of illness. And this is true of just about everything. But the key thing to remember is that illness is not, just because there is an overall global slightly increased, or in some cases, a large increase in risk factors, being successful in some way does not protect you definitively against illness. I've seen people who are rich and people who are poor both get cancer. I've seen people who are good and people who are evil both get cancer. Same is true of mental illness. So mental illness is something that people oftentimes think, if my life is good, then I shouldn't be depressed. But the hallmark of clinical depression is feeling bad about your life when you have no reason to. This is why we call it a pathology, right? So there's something called adjustment disorder, which is when your life is going to crap and you feel bad about it. That is actually normal. But to qualify for a mood disorder, one of the key criteria is that the way that you feel is like maybe somewhat triggered by stress, but then has a life of its own. So in Dan's case, they had just had kids. So it's very stressful. No one's sleeping. It's the pandemic, very stressful. But there is something that sort of develops a life of its own that transcends the simple stress that you're going through. And mental illness does not discriminate, right? So even though there's some data that there are risk factors and protective factors, the risk factors are not they're not invincible. right? So they don't guarantee that poor people are going to get sick and rich people aren't going to get sick. And the really devastating thing about this stuff is that when we blame ourselves for feeling a particular way, I shouldn't feel this way. When we invalidate ourselves and we blame ourselves, that just accelerates the problem. It's a huge problem, right? So I don't care who you are, where you are, how old you are, how privileged you are, how underprivileged you are. If you are struggling, it's okay to struggle and do the best that you can to get help. We build what we can here. And I thought Dan's question was great. Like, what do people do if they can't see a therapist? I think the right answer is the right answer. The fact that circumstances make it difficult does not change the right answer, right? If I get like a bacterial infection and I need antibiotics, the fact that I don't have, if I'm on the moon by myself, that doesn't change the fact that I need antibiotics. So medical treatment for mental illness is the right answer. And at the same time, if you don't have access to it, or even if you have access to it, what we've tried to build here is something that supplements the medical system. It's a public health intervention, not a medical one, right? And this is something that I know we have this disclaimer where it's like, it's not medical advice, and it's really not. It's recognizing that in order to, let's say if we want to tackle obesity as a medical problem, we can start things like medications, we can even have geriatric surgery, and there's diet, there's exercise, there's confidence building, there's mental stuff, there's stress reduction, there's meditation, there's yoga, there's Tai Chi. There are many things that you can do for your health that are not medical treatment, which are therapeutic. And that's what we encourage y'all to take advantage of. That's what we try. We try to bridge that gap because it's way more available for our physical body. There are gyms on every street corner, but there are not meditation centers on every street corner, right? There are like these smoothie places where you can have a healthy smoothie instead of a processed meal. And depending on the smoothie place, it will be loaded with sugar and be very diabetogenic, right? But it's healthy, huh? It's healthy diabetes. Healthy diabetes. We are putting a scoop of superfood. Therefore, it is healthy. No? It tastes delicious. Oh, that's just because it's healthy. Because healthy things taste good. So the last thing that I want to say is, well, this is probably not the last. The next thing I want to say is Dan was spot on about community. And like, I love this, man. This is great. I love being able to be here with y'all. It's a Friday afternoon. Technically, I'm working, but this feels awesome. This is how lucky can I get, and hopefully y'all are lucky too. And yeah, like this is great. We do this because of y'all. Y'all are the energy that keeps us going. So we're grateful for that, right? And so thank y'all very much for coming and being here. We want to share one last thing, which is sort of like a interesting community win. So someone posted something a couple days ago, and we just wanted to share that with y'all. And this is maybe a little bit of Obama giving himself a medal. If you guys know that one, we're going to Google this. Right. So if you guys have, no, what? This is not Obama giving himself medal. Doesn't Google not know? What? This is crazy. There we go. So this is maybe just a little bit of this, but incredible, massive thank you to Healthy Gamer. So the amount of content that HG has churned out in 2024, especially Mental Health May, has been insane. All the live streams from the past 5 months, but especially since meaning, purpose, motivation-based stream, I don't even remember that, have been straight heat for me. So many ideas have clicked and tied together. Dr. K streams several times a week in May, along with reading over 200 papers every other week. And if you guys want to see what I'm reading today, not this week, today, these are the papers we're reading today. Okay? So this is like an ongoing thing. Releasing one book, writing more books, and doing administrative work with HG is massively appreciated. The members channel has also been fantastic. One of my favorite parts being Karma Part 1. The idea of Agami Karma, where our thoughts are seeds that sow future outcomes, and the concept of each action we take like a deck building game was game changing for me. And I paired with noticing that over 90% of thoughts were really are vasanas, mental habits. And there's the neuroscience axiom that neurons that fire together wire together. To me, this supports the idea of vasanas quite a bit. I've also really enjoyed the meditation streams on the members side. I'm hoping to do more tantric practices in the future. I'm very grateful that those ideas were shared. I haven't made my way through the trauma guide yet, but I attended the workshop last October, and that was a 10 out of 10, so I'm super excited. Dr. K's trauma content is among the strongest on the channel, and I can see the passion bleeding every time he talks about it. To me, the trauma content is the highest yield stuff on the channel, and I really loved what was said during either the CPTSD or dissociation streams, where the young generation is dealing with smaller forms of the emotional dysregulation, identity fragmentation, and a physiological rewiring that is present in a full-blown PTSD diagnosis, but the methods of treatment are the same. Someone has been paying attention, chat. Kruthi deserves a massive shout out. Being the CEO of a rapidly growing mental health company that isn't beholden to investors or advertisers sounds incredibly difficult. While Dr. K may be the primary face of the company, there's a massive amount of work happening behind the scenes too. Coaching program seems like a big success, and I'm really hyped for the HG Institute. I've shadowed several psychiatrists in my area, and I think they would absolutely benefit from the continuing education courses that the HG Institute may have. Any videos to change the public school system would be awesome. We're working on that, by the way. I'm picturing some cohort study where these ideas are taught to certain grades and then tracking their outcomes to see if they outperform other classes. I would love to do that. That takes millions and millions and millions of dollars, which we do not have. All of the editors, graphic designers, HG Science Board, all contributing to an awesome vision. Completely agree. There's a much longer HG appreciation post that I've been meaning to write for some time about how my communication has greatly improved and subsequently helped my family not be fighting all the time. I also want to write about how the Samskar trauma concepts have been life-changing, along with the meditation and emotional awareness. In the past, I've had enormous difficulties with studying due to emotional dysregulation issues, avoiding shame, being stuck on the social media dopamine train, feeling unconfident in my studying, operational avoidances, and many more reasons. With a lot of work, studying is now becoming much easier and even enjoyable when I do it first thing in the morning, before I squeeze my dopamine lemons juice with social media. From the bottom of my heart, I'm deeply grateful. Thank you all so much. I saw a member's announcement that Dr. K will be taking a break in July. I'm really happy to see that. Please don't burn out on us. Ha ha. I do hope everyone is able to take care of themselves. So, y'all are welcome. I think sometimes we share wins on the channel. But part of the reason we wanted to highlight this is, first of all, Obama giving Obama a medal. But I think that this person really did a fantastic job of, first of all, this is why we do this. This is sort of the poster child of our audience. So we do this stuff to help people. Right? It is not all for the greater glory of Dr. K. Some of it is, but not all of it. We're really here to help people, because this is the thing is like this person was saying, technology is shaping our brains. And it's not just technology. It's that people like Dan and like yourselves and like everyone else who's come on the stream and posted in our subreddit, life happens to us, but we don't know how to navigate it. We don't know what the impact of our parents' divorce on our anxiety is. We don't know why it's so hard for us to share with other people that we are struggling. We literally know the words to say, and we cannot bring ourselves to say it. We don't know why we keep on avoiding studying when all we want to do is study this topic and do this thing. I'd bet money that this kid is a pre-med, has pre-med written all over him or her. And we don't know, right? We don't know how we work. And we're here to help y'all understand that, because of the way society is going, if y'all do not understand yourselves, we're screwed. Because other people outside of us understand us better than we understand ourselves. And those people are using that knowledge not for your benefit. They're using it to gain your attention, to sell stuff to advertisers, and to make money. They understand you so well. See, all you need to do is look at your cell phone to understand this. Why is the icon the color that it is? Why did people develop things like biometrics and Face IDs? Why did they develop notifications? Why is every feature of an app or something on your phone, or the internet for that matter, the way that it is? And I don't think that these companies are necessarily evil. A lot of people will be like, oh my God, they're evil. I think they have a job to do, right? They have a job to do. Just like anyone who makes a sandwich, their job is to sell that sandwich then. And hopefully they use quality as their main reason. And so it's not necessarily that everyone out there is evil, but those influences are still there. Right? We can create a society that is not intentionally evil, that can still be harmful. Parents can go through a divorce because it's the right thing to do for them and even for their family, because staying together is untenable, will create a toxic household, and it has negative consequences for the children. So this is the way that life is. Not all damage has to be through malice. In fact, I would say the majority of what goes wrong in life is not driven by malice. Right? I don't know that a virus has malice when they infect you and give you COVID. Life is just the way that it is. And to avoid the problems in life, it's not that we need a society that is pristine and good and hyper-moral and perfect in that way. What we need is to understand the system of life. Science has given us so much progress. Science is not about morality. It's not about right or wrong. Science is about understanding the how. That's what we need more than anything else, is the science of how you work. So then you should be in control and you do with that whatever you want. Right? So it'd be nice if you did a good thing, but it's your choice. Right? Nuclear energy can be used to make a nuclear power plant or a nuclear bomb. I think one is better than the other. But that's the way of it. And so the last thing is that this person was giving a lot of people shout outs. The last shout out, which always gets forgotten, is y'all. This is where the biggest shout out. What is Dr. K without y'all? Nothing. What Dr. K is maybe he's Dr. Kanogia, but that's a different person, right? That's a dude sitting in an office seeing patients, and maybe he's doing some good in the world. I won't deny it. But y'all are the lifeblood that keeps this going. As the person said, we don't have investors, we don't have advertisers. Occasionally we'll take sponsorships, and we're going to slow those down a little bit. By the way, we had more sponsorships in May because May is we just do more of everything. But y'all are the lifeblood. Right? Y'all are the ones that show up on stream. Y'all are the ones that show up in chat. Y'all are the ones that teach me what Riz is, teach me what Glaze is, teach me what Ligma is. Where would I be without that? And y'all have also recently taught me what gooning is. Y'all are the ones who post the questions. Y'all are the ones who ask the questions. Y'all are the foundation, really. It's what is this live stream without chat? It's a dude talking to an empty room. That is nothing significant. Y'all are also the ones that support us. So this person signed up for the trauma workshop. The big irony there is it's one of the best things that we've probably ever done. Why didn't we do another one? Because it's very expensive for the people who signed up. Right? It was awesome. We'll probably do them more in the future, but we wanted to make something more accessible. Sold out in 24 hours. Everyone loved it. Right? And so y'all are the ones that the reason this works is because of y'all. Y'all are the ones that ask the questions. Y'all are the ones that sign up for stuff. Y'all are the ones that show up. And, the Healthy Gamer doesn't exist without you. And people like this posted this thing, and therefore that is the content that's what I read out loud is y'all. And so, the only way this works, so Dan said, it takes a village to raise a child. I think it takes a community to save the internet. And I see so many things. Someone was talking to me today about women who date men who are becoming increasingly misogynistic because of the social media content algorithms. And this is where there's a lot of people will say oh yeah, if this person is descending into misogyny, just break up with them. I don't like that. I think that when someone is doing something wrong, we should make a full faith effort to try to bring them back onto the right path. And who are we to decide what's right or wrong? I don't really know. Right? So I think that there's so many problems. The problems are emerging. They're evolving. They're evolving faster than we can keep up with them. And someone's got to do something about this. Like right now, the problem in the dating world is it's so easy to dump someone. It's so easy to ghost someone. No one makes an effort to help someone else. No one tries to pull someone else in. It's all my way or the highway. I don't like that. Right? And so we're going to do what we can, but we can't do it on our own. We need you. Y'all are actually the lifeblood. I'm just the face. And so a huge thank you to y'all for making Mental Health Awareness Month as possible as it was, to make it as big as it was. Y'all are the ones that are clicking on the thumbnails, showing up at the live streams. And without that, I would be working in an office. So huge thank you to you. And we're going to continue to need your help, and the rest of the world needs your help. When Dan does the work that he does, it's not just about his benefit. It's like now their dad has gone to therapy. And imagine what your life would be like if your parents had gone to therapy. If you're lucky enough to have parents who went to therapy, hopefully that was helpful for you. Right? So this is the last thing that y'all really need to understand. It's not just about me and Healthy Gamer and you and, oh my God, he's glazing on the community. Oh my God. No, y'all are each and every one of you is a human being, and you will impact hundreds and thousands of lives. Your goodness, your assholery will impact other human beings. And the whole problem with the world today is that people don't really appreciate that. Right? If you look at the people who hurt you in life, how much are they aware of the power that they have to shape your life? Whether it's someone who doesn't answer your texts, someone who ghosts you, someone who makes fun of you, someone who bullies you, someone who cheats on you. People don't quite understand the responsibility that they have. And y'all have a big responsibility as well. Right? And I'm not saying that everyone can be perfect all the time or that everyone can even be good all the time. Sometimes life makes us do things that can be damaging or hurtful to other people. And even if we have to do that, so for example, there are times where I've fired a patient, right? A patient, I'm their doctor, and then something is not working out and I'm not able to help them. Or what's much more common is people ask me for help and I say, I'm sorry, I can't help you. That happens very commonly. So when I started streaming, I was getting between 5,000 and 10,000 requests per month in my private practice. No way I can help all of them. Barely any of them. Almost none of them. So I had to say no. And that's hurtful to someone. I don't have a choice. I just can't see 10,000 people a month. Just not physically possible. And so sometimes in life, we have circumstances that force us to take actions that can be hurtful to other people. But even then, at least have the awareness of it. Do whatever you can to soften the blow. And in the situations where you make mistakes, learn from those mistakes. And then next time around, try to soften the blow even more. Right? This is what we have to do. It's the only way that this is going to work, y'all. We're responsible for this world. It takes a village. It takes a tribe. It takes a community to try to fix this place. And the real tragedy of humanity is one person can screw things up way more than one person can fix them. Way easier to break something than it is to make something. And since I've been gaming recently, it only takes one player on your team to throw your game that you should win. But it takes all of y'all working together to make a comeback. It only takes one to throw, but it takes everybody working together to undo a throw. You just need one noob to feed. You just need one toxic person to tilt everyone else on your team. This is the world that we live in. This is why it's so frustrating to play multiplayer games. Right? This is the life that we live in. So we're going to do the best that we can. I'm doing what I can. I'm done for the day. I'm going to play something. I'm not going to play Elden Ring because I can't get that started. I have too much work to do. So part of me being a healthy gamer is going to be waiting until I'm done with all of my work and have a lot of work done, and then I'm going to have some bandwidth. But I will play maybe a little bit of Star Sector, maybe a little bit of Dota. We'll see. And I hope you all have a wonderful weekend. Thank you so much for coming, not just today, but for the last 4 years. Honestly, from the bottom of my heart, thank y'all for being here and coming every day that y'all do. Because we would be nothing without you. And the world would be, not to say that we're going to fix the world, but the world would be, dare I say, more screwed without what we're doing here. So this is really important. And thank you so much. I'm going to go feed and maybe lose some MMR. We'll see. And y'all have a good week.